This is Black Mental Health Matters. I'm Dr. Kerry-Ann Williams. I'm a psychiatrist practicing here in Massachusetts. And this is a podcast that's about everything related to mental wellness in the Black community and beyond. Today, I wanted to talk with you about a question that comes up often in the mental health community. It is a question: is it even necessary to see a therapist? Can't I just use lifestyle changes, such as exercise or healthy eating or hobbies? Maybe I just need to get some more rest, or I just need to reduce my work stress. Why do I need to actually go talk to a person? And how do I know if this person can even help me? And this is an understandable question. Not everybody gravitates towards talking things out with another person. And sometimes I found that people have different perspectives on this idea of having a therapist. So today I want to talk with you about some of the top reasons that people don't go to therapy. And this list isn't comprehensive, so I would invite you to share on social media in the comment section other reasons that people give for not going to therapy. Also, this list is more about reasons for not going to therapy for the first time. So if you've tried therapy before and decided you didn't want to do it again, you may have certain reasons for that, but you did try it. And you have options. If it didn't work with that person, you can change the person or you can change the therapeutic approach. Remember, we all kind of receive varying levels of training. We all have different strengths as therapists. You'd be surprised at how much of a difference it makes to go to a different person. So, here are some of the reasons that people have given for why they are reluctant to go to therapy. And this is in no particular order. So, number one, you may feel like you already have a lot of supportive people in your life. So, you can't see why you would need to go talk to a stranger. And it's great that you have a lot of supportive people in your life. It works in your favor to have a lot of supportive people in your life. The difference, though, between a therapist and your family and friends is training and objectivity. Your family and your good friends, they have an emotional bond with you, and they may hold their own personal hopes and dreams for your life. And any discussion you have with them will be inherently biased. They're going to lean towards giving you advice. A therapist, however, may not necessarily lean towards giving you advice. They're trained to help guide you through a process of self discovery and decision making based on your own values. So, therapy is a place where you can bring the confusion of what other people are telling you and what you're telling yourself and unpack that and work towards clarity. Now, the therapist will also be trained to notice patterns as an outsider looking in, and they can reflect their observations, and you can have that discussion with them. And they'll also do something else that's not as fun, which is that they will sometimes ask you questions that will challenge you and it will challenge the status quo. And that serves to bring a greater kind of consciousness to why you do what you do. So, if you feel like you don't need a therapist because you already have good friends and family, remember that a therapist is not a friend and therapy is not friendship. They're not interchangeable. Therapy has a different purpose from friendship, and those important differences are what makes therapy powerful. Number two, you may be reluctant to go to therapy because you found that the people in your life have historically been generally unhelpful. So you generalize that to say that people are unhelpful and talking to people is unhelpful for you. And therefore, why would you go talk to another person? Now, this may go back to the history of how you solve problems in your life. You may be that person who is a self reliant problem solver. Maybe you're the kind of person who doesn't normally solve problems by talking it out, right? There are some people who like to solve problems by talking it out and others who don't. So here's the thing: Therapy does usually involve talking. But as I mentioned in the first point, this is not like talking to your friend or your family member. So I would encourage you, first of all, to think specifically about what has been unhelpful about talking to a friend or a family member. For example, friends and family members often go into problem solving mode and they start spouting out advice. Here's what you need to do. Or they tell you, don't feel sad, don't feel so bad, don't get upset. And they unwittingly end up invalidating your emotional experience. And they mean well, but with friends and family, you may walk away from that situation feeling like they don't really understand you. And a good therapist is trained to avoid the common pitfalls that makes these conversations unsuccessful. They're guiding you through your own process of clarification and insight, and they provide the emotional validation and structure that you need to build on your self-reliance so they can help to improve your effectiveness in your areas of weakness. Number three, you may be reluctant to go to therapy because you may see therapy as a sign of severity and think to yourself, I'm not at that point yet. Now, that is based on your perception of what therapy is and what therapy represents. Your perception is that therapy is for people who are beyond a certain point and you're not there. In addition, you may feel like going to therapy indicates a certain level of helplessness, and that at some level it represents some kind of defeat or loss, especially the loss of self reliance. And that can be a difficult thing to experience emotionally. As I mentioned at the other point, therapy can actually increase the effectiveness of your self capabilities. But I want to address the idea of therapy as being a sign of severity. I would reconsider that perspective and think of it this way, that therapy should be considered when you feel like you need something more than what you have to solve a problem. I think that admitting that, though, is hard. And I think that we worry greatly about how it's going to be perceived by other people. It could be as simple of a reason as I feel overwhelmed and stressed all the time, and I need a little bit of support with figuring out how to solve this. As simple as that. You don't have to be depressed or anxious, even though therapy is good for that too. It could be, I have chronic stress and I need to figure out how to improve this. For some people, it might be, I notice a pattern, like I keep ending up in bad relationships. How can I solve this problem? But here's the other thing that kind of goes along with this. Um, the fear that therapy is kind of seen as a sign of severity. You may worry that if you tell someone that you're in therapy, that they're going to think that something is secretly wrong with you. That's a very anxiety provoking thought to have. Is someone going to see me as less capable of my job? If a politician is hospitalized for depression, does that make that person less capable in their position? This is a kind of stigma that prevents people from coming to therapy. Therapy does not mean that you are a severe case. Rather, it is a sign that you have allowed a professional to help you solve a specific problem. In the same way that you would consult a plumber or an electrician, you're calling on a professional to guide you through how to address a specific problem. It doesn't make you less capable of handling anything else in your life. Number four, some people don't go to therapy because they feel like they just don't have the time. Well, time is a challenge, isn't it? Therapists want to work regular hours just like everyone else. Some of them have evening hours, some of them have weekend hours, but most of them are Monday through Friday. So you are going to have to figure out a time that works for you. Now, if it is in the middle of the day, maybe it has to be a video appointment. Maybe instead of a weekly appointment time, it will be every other week. Maybe instead of having an indeterminate end date to therapy, you do therapy for a period of time, then take a break and then come back. Now, that's going to depend on your individual needs. Time is usually a reflection of priorities, unless your time is controlled by someone else, like your employer. Number 5, some people don't go to therapy because they're worried about privacy. Who has access to my information? Am I going to become an anecdote that this person shares with their colleagues? Are they going to attempt to de identify but still share my stuff on social media in order to get views and likes and follows? Where does my information really go? You have a legal right to privacy, and any limitations to your privacy usually have to do with safety. Otherwise, um, there are certain things that you can do to assess privacy. And I should say, you have a legal right to privacy. Usually at your first appointment, someone will go over the privacy laws and your right to confidentiality. And as I mentioned, usually if it's something related to safety, maybe you're going to hurt someone else or you're thinking about hurting yourself, those are kind of what we call the limitations of confidentiality. So we can get a third party involved for the sake of safety. So here's some of the things you can do to assess privacy. I had mentioned, does this person have a social media profile? Do they have you can always check that out and see, do they have a tendency to, um, share patient information in a de-identified way on their social media pages? You can check that out ahead of time. Um, but if you're going to be seen in person, you can observe the physical layout of the space when you get there. Is it a crowded waiting area? Is the office generally quiet? Are there white noise machines kind of muffling out the sound from the offices that you walk past? So that's kind of thinking about the privacy of just the space. You can ask a therapist about how records are maintained. Do they use an electronic health record? Is it a paper chart? They should be able to clearly explain how records are maintained. And release of information forms for third parties will require your permission. So an insurance company, for example, might need to know your diagnosis for billing purposes. So all of that should be transparent. And then also, there's telehealth, there's video appointments, and you can ask your therapist about their physical space. They should be able to confirm that they're in a private space. I've found, though, that when it comes to telehealth, it's usually more challenging for the client than it is for the therapist. The therapist usually has a dedicated spot, and many of them I've noticed actually even wear headphones during their video calls for like even an additional layer of security. But I found that it's the clients that often have more difficulty. In fact, I've had times where people tell me that they're alone. And then when I start bringing up their personal details, they say, wait, 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 stop, stop. And then they disclose that actually there is someone else in the room and they don't want that person to hear their information. Um, or sometimes you see someone walking behind them in the background. So I've found that it's often more challenging for clients than for therapists when it comes to privacy around telehealth calls. But definitely you can ask the therapist about their space, and privacy. So privacy is a right. But there are things that you can do, you can ask about and you can kind of check out to ensure privacy of your information. Number 6, and lastly, is cost. Sometimes people don't go to therapy because of the cost. Now, most insurance carriers have therapists on their list of providers, so that's always an option. But there may be people in the community that you want to see that don't accept insurance or the insurance carrier that you use. And so if cost is an issue, you may have to go through your insurance carrier. Otherwise, there is going to be a private pay cost, and that will vary depending on the level of training of the provider, their licensure, their individual set rate. And if you can't afford weekly therapy, maybe you'll have to do every other week, or maybe you'll do a limited number of sessions that you can budget for. So those are some of the reasons that I kind of thought of today for why people don't go to therapy. If you have additional reasons, definitely share them in the comment section. Um, are you thinking about going to therapy, and what are your reasons that you haven't gone yet? Especially now in the time of telehealth, it's easier than ever to try out therapy, to shop around for the right therapist. And if you do decide not to go back to a therapist, like let's say you're kind of setting up appointments, and you go to see someone and you decide you're not going to go back, I would say that it's helpful for you to simply tell them that you're not returning and that they can close your client file. For legal reasons, sometimes it's helpful for the therapist to know whether or not they should be keeping your file open or whether they should close your file. Now, before I go, I didn't specifically mention cultural factors today. And this is a podcast on Black mental health. And I know that there can be additional cultural reasons for why people don't go to therapy. And I've spoken about these in previous podcast episodes. And so sometimes I feel a little bit self conscious about being repetitive about some of these things. But I also think some of these same factors that I've spoken about in the past can fit into the categories that I've already mentioned. So there is that need for self-reliance in the Black community. And there's that feeling that going to therapy can be a liability because of fear of what others might think, how you might be perceived, but also how you might think about yourself based on what you've been told throughout your own life. There's a lot of historical reasons why there's a fear in the Black community of being seen as less capable. There's also a lot of fear about survival in a white dominated system and how mental health diagnoses and treatment historically could be weaponized to work against the Black community. There's also something to be said about the mental health treatment approach that is historically steeped in white cultural values. So, for example, white culture values individualism, whereas Black American culture tends to value collectivism. And these days, there's a lot of discussion about what mental health treatment might look like when cultural values are applied, especially with the field of like Black psychology. There's a lot of discussion about rethinking how mental health treatment is delivered and how it would look if these cultural values are really considered. Now, it can certainly make a difference to have a Black therapist, but there's still not enough of us out there. And if you have a really good therapist, even if they're not Black, you may be surprised at how helpful it can still be. Also, even if you have a Black therapist, you may be surprised at how unhelpful it could be if you have somebody who's just not a good fit for you. So it's good to have representation, but it's not everything. The most important thing is the how much of a good fit the therapist is for you. Now, cost may be another issue in the Black community due to economic disparities, which means that a disproportionate number of folks in the Black community cannot afford the private pay therapists and tend to rely on insurance. So it limits the pool, that limits the number of therapists they have access to. And that's all I have for today. What are your reasons for not going to therapy? And what reasons have you heard from others? Thanks for listening to Black Mental Health Matters. I'm Dr. Kerry-Ann Williams. Take care and have a great week.